Well, it's 9 o'clock, so I think we can go ahead and get started. We have a small group today, but that is okay. We're going to start out with brief introductions of who we are speaking to you today. So my name is Lacey Brown. I work for South Dakota State University. I am a gerontology field specialist. So a lot of my work focuses on education related to getting older. And I'm going to let my colleague Lorna introduce herself.
Good morning, everybody. My name is Lorna Sable-Wounded, and I am the Family Resource Management Field Specialist at SDSU Extension, and I primarily do work in the area of personal finance education.
Thank you, Lorna. I want to talk briefly about the Organize This team. This program really did emerge out of the collaborative efforts between Nebraska Extension, North Dakota, and South Dakota Extension. Really, the focus of this program is on organization and legal concepts that apply across state lines, because we do get into some of those legal concepts, trying to help people become more informed consumers. This means that we do not emphasize topics like titling property or assets or using trust to protect assets. Really, this program is designed to increase knowledge about foundational legal concepts around caregiving and death. The objectives for this webinar. The overarching purpose of our time together is to introduce you to the Organize This program, discuss our plans to expand the availability of the program in 2027, as well as learn about the facilitator training that we're offering this fall. The topics that we will cover during this talk will be the program development and pilot, the 2026 offerings of this program, what we're doing in 27, and how you can adapt this program to your state and audience. So each person will be affected by one or more of these difficult life experiences that I have listed on the screen, and I call these facts of life. And those are accidents, chronic diseases, illness and recovery, aging and frailty, the loss of a loved one, terminal illness, and dying. As a result of these experiences, another person may need to assume responsibility for an adult's medical or financial decisions. So now I want you to pull out your chat box. I forgot to ask you guys to tell me where you're from. I'm in Rapid City, so if you want to write where you're from while we're using the chat box, you can unmute too. I don't mind. We're a small group, so we can unmute. But I want you to think about a time when someone had to step in and make important decisions for another adult. What challenges or concerns came up? You can unmute, you can type in chat, but I want to hear from you. We got Aberdeen, South Dakota, Big Rapids, Michigan, Lawrence County, Indiana. Welcome. We got Vermilion. We got NDSU. Very good. Sorry, I should have done that sooner. I was curious. It's good to see the representations from so many states. Let's think about this question again. Think about a time when someone had to step in and make important decisions for another adult. What challenges or concerns came up? Welcome, everyone. Ellie writes, not keeping a dying family member's wishes in mind. Okay, that can come up. There can be conflict between the decision maker and what the person wants. Philip writes, the expenses associated with care. Yep, that's definitely something. My siblings and I had to take over financials for my parents while they developed Parkinson's disease. Wow. Did both your parents develop Parkinson's disease, Rebecca?
Yes, unfortunately.
Wow. That's like the most horrible lottery to win. I'm
Yeah,
sorry.
no, it's true. But
Wow. So what was it like when you had to take over those finances?
Well, I think looking back, the one thing I'm, really grateful for and took for granted, because I'm learning it's not the case for others, but my siblings and I were very aligned and did not disagree on how we wanted to collectively manage their finances. So because, as time goes on and I share this about my family, I'm realizing that there's some conflict, and conflict is, probably more normal around things like this than no conflict. So,
You were 100% correct. Thank you for sharing, Rebecca. Carolyn writes, I had to take over POA for my mom when she was dying. She was pretty out of it, but because I had worked for the court, the lawyer was willing to go forward. Christy writes, when it's not safe for them to drive. Uh, Never having had the conversation when someone is incapacitated. Currently the healthcare POA for my sister. Um, so the fact of the matter is, let me look at my notes. My important reminder before we move on. Too often, people assume that once someone begins managing financial and medical decisions, they will continue in that role until death. This role can be temporary, ending once the person recovers from the difficult life experience. And I think that's an important thing that sometimes gets forgotten when we're talking about these facts of life type experiences that we will all go through. And as we've kind of talked about, emotions come up when planning for someone to take over your financial or medical affairs. Sensitive issues have to be confronted. Choosing a decision maker can bring up family tension. One person might feel excluded if they're not named as the fiduciary. Planning forces people to face declining health. And that unfortunately is not something that we do very well. Conversations about pair connect to thoughts about death, and that can be extremely uncomfortable for many people. And then there's also this unequal distribution of assets can create tension and difficult conversations. This reality really informed the project team as they developed the Organize This legal and financial must-have program. That is what we're here to talk about today. This program includes 40 90-minute sessions offered over 10 months. This timing aligns with New Year's resolutions, tax seasons, and as well as the holidays, which works well with trying to help move people forward so that they take action. The call to the action at the end of this program is to find appropriate times to discuss with family and fiduciary when gathered together during the holiday season. It may sound morbid to you, but there is tremendous value in having these conversations in person, face to face. I'm not saying doing them over dinner while you're eating, but maybe later while you're sitting and visiting, having some of those conversations. So we really try to emphasize that at the end of the 10-month period. Office hours are available between sessions to allow participants to discuss more sensitive issues individually or receive individualized support. Peer support groups are being added to the model in 2027 based on the evaluation results from 2025, which we'll get into that more later down the road. The strength of this model, it is designed to make the progress feel manageable to participants. It breaks complex content into chunks so that people have time to absorb the information. The time between sessions allows people to work on their goals. And then it also creates time to think, reflect, and come back to the facilitators with questions that may have come up. Are there any questions jump into mind immediately about this model? We have done it in person and virtually. Any questions immediately right now? Go ahead, Rebecca.
yeah, I just maybe you will address this later on, but I Can you share with us how well how many people are you teaching this to at one time? Like, is this a well participated program? And assuming it is, will you share the secret sauce for attracting participants?
Yeah. So I'll tease that information a little bit. We had 36 or 37 register in 2025. About 20-ish, 22, I think, kind of followed through towards the end. So there was some drop off. But we did get that many. And then in 26 for the registration, we had 36 virtually and 16. But we'll talk more about that.
Great, thanks.
Not a problem. Content that we cover during the session. So in January, we introduced the concept of fiduciary. And we use this term, which the question I have, is fiduciary a familiar concept to the people in the room, or is it unfamiliar? You can type in chat, you can unmute.
And they're the same. I'm sort of familiar with it, but not in this context. So
We're good. Oops. Part of the reason we emphasize the term fiduciary is, because it really talks about that legal and ethical responsibility a person has to act in another's best interests. Understanding this helps program participants choose the right person, set clear expectations, and avoid problems later. This screen has all the content that we cover during each session. Like I said, we talk about fiduciaries in session 1, as well as the documents and information that a fiduciary needs access to. So the fiduciary are those people that are signed through wills, power of attorney, and trust to act for another person. In April, we talk about managing technology and digital assets during life and at death. During July, we review those unpaid fiduciaries, and then we discuss paid fiduciaries that a person might hire to help them with their legal and financial planning. We also talk about credit reports and freezes and help folks understand how that can keep them safe. Finally, that last session is really about communicating with relatives and fiduciaries, as well as the consequences of disorganization and missing legal documents. So we really cover a wide range of content in this program, trying to help ensure that our participants have, a robust understanding of how all this stuff works. We engage an attorney in this program during session 1 and session 4. We give them 30 minutes in session 1 and 45 minutes in session 4. And their role really is to explain that concept of fiduciary, talk about the duties and responsibilities of fiduciaries, as well as what they need access to. Then at the end of the program, our guest speaker comes back and she does a review of legal documents that adults need. She talks about professional options for fiduciaries because some folks have nobody that can serve as their fiduciary. So she talks about professional options for hiring a fiduciary to serve as an attorney in fact, or under the will. And then finally, she explains conservatorship and guardianship and why those processes are triggered. Switch my pages forward. So we provide program participants with a binder. We elected to not create any sort of workbook. In the chat, you will see a link to our resources, and I'll talk more about that, but I encourage you, I have no problem if you want to grab that link and just take a look at some of our resources. But again, we decided that a workbook was not a sustainable approach. We don't need a large document that we have to maintain and update. Instead, there are many different extension organizations, reliable third-party organizations who already have fact sheets, articles, materials that teach about, powers of attorney, wills, the advanced directives. There's already a lot of existing materials in all of your states that cover these contents. So we give participants a binder that is broken up into themes based on each month that they have a session, an educational session, and it supports the content that is covered during each 90-minute session. Let's see if what's missing anything from my notes. The only really mandatory thing that we want you to include would be our Organize This toolkit. What I found as I was looking for materials to decide what to do for South Dakota, there were a lot of workbooks and articles, but I couldn't find just a list, just a document that has a list of the documents and informations that an adult might need. If you click on that link in chat, it's got our resource page, and you can actually scroll to the bottom and grab the toolkit that I'm looking at right now. And this toolkit has a list of documents and information that a person might need. And I know it looks overwhelming. It's 2 pages long, but the step one for the process is to cross through what doesn't apply to you. We introduced this document during week 1. And I'll tell you, Lorna's going to talk about our evaluation results and more in depth. But our participants really felt like this document opened their eyes to just the types of information that their fiduciaries might need. So that's the only required thing. This document also includes a health information summary for your healthcare fiduciary, your healthcare power of attorney, that attorney in fact for healthcare. There's a health information summary that outlines the different things that they would need to know about you, such as your blood type or any durable medical equipment you use. And it also has a medication list. This is the only required document. The rest of the stuff, you're able to really pick stuff from your state that might cover, like I said, wills, advanced directives, power of attorneys, digital estate planning, communication, whatever resources you have, because that's what we did instead of making a workbook. We curated resources and organized them in a binder. And for our virtual participants, we mail them the binder. And then for our in-person, we just gave the binders to them. Okay. Any comments or questions about the binder? Okay. So what are the objectives of the Organize This program? The goal of this program is for participants to learn about common legal situations around caregiving and death, as well as organize the different documents and information their fiduciary might need in various situations. By the end, they should be more informed consumers who feel confident around caregiving and end-of-life conversations and decision making. The target audience for our program, really, we are targeting adults age 40 and older. Too often, we're going after that older adult audience for these issues when we need to start planning sooner. Many of the options that are available to us as we get older really are determined by the actions we take as younger people. So I really am trying to engage younger people. However, there is value in maybe focusing on family caregivers or adults with children or adults with dependents, because those individuals have more shared life experience. So this is really who we're trying to reach with this program, because these are all groups this is very relevant to. What's super interesting with our 40 plus folks is we often had people come into our program thinking that this program was to help them with their parents, and they learn that this is applicable to them, that this matters to them. So it's really kind of a good program in that respect. The 2025 pilot. We offered it at no cost due to a grant from the American Association of Family and Consumer Sciences. We had 36 registrants and a wait list. The program was offered virtually using Zoom. Participant engagement, January session had 27. We had 24 in April, 20 in July, and then 22 in our October session. Participants had the option to watch the recording and then send a paragraph. And some participants chose to do that to get credit for participating in the program. 18 of our participants participated in the office hours program, and then 16 consented to our post-program interviews. Participants completed pre and post surveys that measured knowledge, confidence, and the tasks that they completed. So the evaluation results, pre-post program, they gained in knowledge and confidence. The pre-survey, they got 73% of the questions right, and then that increased to almost 90% of the questions right at the end of the program. Their confidence increased from pre to post to select a person to be a personal agent or a power of attorney, and their confidence in locating important paperwork increased. And during the interviews, they really like that checklist that I was showing, and I've got the link for in chat. That they really like that checklist. They like how the program is structured. They needed a little bit more assistance and support, which is part of the reason we want to add the peer support groups in 2027 to really have a little bit more in between session accountability and discussions to help them be a little bit more accountable. For some of them, it was great. Just the program itself was enough structure to get them to complete tasks, but others did need a little bit more support. Our participants indicated that they communicated with their family, they updated accounts, they created or reviewed legal documents. Meeting with a professional was the one task they weren't doing as well. I see it this year a lot with the participants that I'm teaching. There's a lot of reservations about working with attorneys and the cost. So I think that, that probably tracks with just the fact that people are intimidated by how much it costs to work with a professional. Let me check my notes and see if there's.
I had one thought, Lacey, if you don't mind.
Go for it.
I just want to explain that. So for 2025, it was a pilot. So we did the post-program interview to check and see how did this go. I don't know that we'll continue the post-program interview in subsequent years. We mainly did that just to see, did this work? Were participants happy? What did they get out of it and that type of a thing. But that doesn't mean it can't be done. It's just that's the reason we did it in 2025. And then for the pre and post, I just want to point out that knowledge gain, we had a list of like 18 or 19 terms specifically related to like estate planning and things that we were talking about in the program. And so before the program started, we had the participants take that survey. And we asked, don't look up the answers, just what do you think the answer is for these terms? And then they did the same thing at the end. So that's where we have that knowledge gain, like from the program. So before they did the course, like Lacey said, there was the percentage was 73% correct. And then when they finished it, it was about 90% correct.
Thanks, Lorna. That was perfect. I appreciate you. Overall, the participants had a lot of positive things to say about the program. And they offered feedback. Like I think that peer support was good feedback for the program. They reminded us that we got to nudge them to engage professionals sooner. One of our participants lost a loved one. I don't know if it was during the program or after the program. She lost a loved one, and I don't want to go into too many details because, yeah, but she needed to talk to an attorney sooner because there was property involved, and they needed to really talk to an attorney much earlier than they did. So I think it's really important to engage a legal professional, especially if there's property involved. You can't delay on that. So I think that's one thing that we know going forward is we've got to encourage people to take that action. So the 2025 evaluation results. Lorna, do you want to? I'm like, I feel like I almost should let you talk about it because you were our data period person.
Yeah. So this is just a few more questions that we had with the interview. We asked our interview participants if they had actually, like how the experience went asking someone to be their power of attorney. And for those who did ask, said it was very receptive, positive. Um, one person commented that the person they asked said yes, as long as it doesn't happen for 30 years. So they may have been a little hesitant, but they said yes anyway. But then, as Lisa already mentioned, others didn't knew they needed to do this, but hadn't quite gotten to it yet. So, but I feel like just the fact that individuals knew it needed to be done and it was kind of on their mind of something to do, that was very positive. We also asked how did caregiving end of life discussions go, and in a few cases it was the conversations were with their parents about what their parents' plans were, not necessarily talking with their children about what the participants' plan was. But either way, a conversation did happen. And in some cases, the conversation, it got started and kind of eased into it, but maybe doesn't necessarily finish the conversation, and maybe need to continue with that. And then we asked how has your perspective on kind of planning for end of life things shifted? And there's definitely a greater awareness, a shift from kind of that thinking about it to actually doing it, so being more proactive. And then the awareness of kind of the importance of it and really not putting it off, especially in terms of putting together a will, considering their whether or not they need a trust or not, and then even looking at who their representatives would necessarily be.
We
You want me to do this?
Yeah.
Sure.
Do you want to? I mean, I'll let you talk about this, and then I'll talk about the next slide.
Okay, sounds good. So, we love to collect quotes because that really can show us really what people are thinking. And so here's a few select quotes we had, because we did those interviews, we had quite a few quotes. Even with our office hours, we were able to, collect some opinions on different things. But, one quote, there's so much more that you need to know if something happens to your loved one. And that's an important thing. A lot of times people go into this situation where they don't even know what questions to ask. And especially if they don't even understand how you would go about getting a healthcare or a financial power of attorney. I think this program really shows the importance of just increasing people's knowledge about those end of life decisions, and then what you can do to prepare for that. You can never do it with just a couple of months. It would be too overwhelming. So that was one benefit of this program. We could have sat down and done a 2-hour program one night and gone over everything and then just let everybody go. We intentionally chose to do a more strategic plan where we worked with people throughout the 10 months, and really even just encourage them, no matter what you've gotten done, you've done something more than if you hadn't been a part of this program. So I think we have good documentation that shows that it's important to spread out this program, that it's not kind of a one and done type of a thing. There are things on there that I wouldn't have ever thought of, like how do you get into your email address? So that was some of the technology things that we addressed in terms of help providing a way for others to get access to our personal information when it's needed, but still being able to keep it safe and secure. And then the only wrong way to do it is to not do it at all. You just have to start somewhere. So throughout the year, even those that we interviewed who maybe didn't make a lot of progress, we just, you got to start somewhere, and just even knowing more about this topic is important.
I posted the link to our checklist in chat. I know we had someone join just a second. I highly encourage checking out our checklist. That's the document that the participants said there were things on there that they would not have thought of. So yeah, definitely. Kim says we have a book with everything with passwords, where stuff is, bank accounts. The kids know where the book is, and we keep it updated. That's huge, Kim. But the challenge we see, Kim, is there's a lot of people who have not kept their documents organized. So 2026, what did we do in 2026? So we are co-facilitating the program virtually between SDSU, NDSU, and Nebraska Extension in 2026. We charge participants $50 for the program. That largely covers the cost of printing, binders, and mailing. We had 39 registrants and a wait list of 25 people, and we continue to offer office hours to our virtual participants. I was approached by Noreen at the Meade County Senior Center in Sturgis about offering the program in person to her members. She offered to sponsor the binders, so I said, sure, let's give it a try. So we are offering it in person. It is free to members and $25 for non-members of the Senior Center. We had 16 registrants. This offering includes office hours and peer support. So this is how the program is being offered. We also had a request to offer the program to the deaf community, and we planned for it in person and having interpreters available. Unfortunately, we didn't have enough people sign up, so we want to regroup and try to figure out how to make that one work, because we know the interest is there, but we don't know, kind of how it was explained to us, there could be a language barrier that's happening that we just have to work on overcoming. But we do know that our South Dakota DROP program, that's Deaf Resource Outreach Program, I think that's what DROP stands for. They are interested in being trained to facilitate the program in 27. So we hope to reach the deaf community. So it's very exciting to see how well the program is doing in 2026. And, we are planning in 2027 to train facilitators at the end of this year so others can offer this program in other parts of South Dakota, North Dakota, and Nebraska, as well as other states who might be interested in this program. The program facilitation in South Dakota, we're going to work with true volunteers, sponsored volunteers, and we're going to probably emphasize trying to reach caregivers. And then we want to explore an options for a youth audience that really kind of a little smaller, like that checklist that we give to older adults. I don't think an 18-year-old needs it, but how can we teach young people that they need to keep their documents and information organized? Can we start those skills when people are 18, 19 years old? So now I'm going to give it to Lorna because it's her turn now. And then we'll come back for questions.
All right. Thanks, Lacey. And I just want to point out, Rebecca, if we don't really answer the question that you asked originally, make sure you ask that at the end so we can fill in any gaps that we may have missed and for that question that you had asked. But so we did a multidisciplinary team with agricultural economics, gerontology, and family resource management. And we felt that we were intentional about this because a lot of questions that people have or may have can fit into those different areas. And my area is family resource management. And so I can answer, questions about, like 401ks, beneficiaries, wills, that, some trust, that type of thing. But if someone has a question about maybe succession planning for a farmer or rancher, that is really not my area. And then with questions related to older adults, and that's the gerontology area. So this is really it provides an opportunity to really meet the person where they are in terms of what it is that they need. And when we do our office hours, we ask individuals, to list what their questions might be, and then that helps us determine which specialist is going to be able to work with those individuals. Caregiver support professionals are individuals that they serve to enhance the professional knowledge of kind of legal concepts and some aid that they can use to support their clients. And these can be like nonprofit caregiver support programs or social workers in hospitals. And this is the piece that we're hoping to expand to with our facilitator training, is being able to, provide that, because a caregiver support professional can answer another set of questions that we would not necessarily be able to answer. All right, next slide.
I want to comment about true volunteers real quick. True volunteers ideally need to work under specialists. Like you don't want a true volunteer offering this without that multidisciplinary team, so they can like phone a friend if they get a question they don't understand. So I just wanted to touch on that.
Okay, thanks. So one thing that, and this has mainly been Lisi's task. She's created the Facilitator's Guide. And so once we started the program in 2025, and then throughout this year, she's continued to work on kind of putting that guide together, that's a roadmap of how to implement this program with nonprofit organizations and other extension programs and that type of thing. The training that we're going to offer in October, everyone who participates will be given that facilitator guide, and our training will, essentially kind of go through that guide so that you understand how to use it. So it describes the 10-month program on legal and financial planning. It will include an outline of the sessions, the goals, the materials that we provided, and the different roles for the facilitators. It'll also include our tools, the timeline, and some additional support strategies to help the participants get organized and to plan ahead. For the session content, we aren't going to send PowerPoint slides, but we are going to provide the text so that the facilitators are able to create their own presentation slides, kind of using their own. Like we have SDSU extension on all of our slides, and so other organizations will, want to be able to use their own personal branding with the information. So you'll be able to, adapt your information, the facilitator as you see fit, and then develop your own presentation slides, and just be able to make it your own, but you don't have to start from scratch. Okay, so what our plan is for the end of October, and we haven't finalized the dates, nor have we finalized the cost, but we wanted to be able to just give you an idea of what to look for, and then to be able to block off those dates if you are interested. So it's going to be a 6 to 8 hours of live virtual training over 2 days, and what our plan is we'll do half day one day and half day the next day. So that kind of in between the sessions, you're able to kind of do a little bit of homework in the sense of maybe thinking about how you would put this together, what questions you might have for us before we wrap up the training, and be able to just kind of like, how would you be able to implement this with your organization? And then we'll, help with a follow-up on that during that second session. We will have a cost or a fee for this training because of the resources that we're going to provide for individuals. We'll also, as a part of the training, we will provide we're going to provide that peer support. So throughout 2027, as you're implementing the program, we'll have periodic meetings with everyone who's in the who completed the training to provide that support to see how are things going, what are things that that you need help with, is there anything that you're discovering that we want to be able to implement and share with other people. And Lacey, I'm going to have you talk about the licensing fee.
That licensing fee, I have to wait till I talk to the attorney to make sure there's nothing I have to do with licensing fee. I mean, that's the honest truth. I have a meeting with the attorney next week. My hope is to not have any crazy fee. I mean, we really, I meant to highlight that you're going to need desktop publishing skills or PowerPoint skills or those skills. We don't want it to be super complicated. We don't want to have to deal with a bunch of licensing. We are considering a refresher training because we're going to give you a document that's got links to educational materials that align with the program themes that you could use. You're still allowed to go curate your own resources. If you've got state stuff in your state that works, fine, great, use it. But like we use some materials from Montana for our binder, so we'll give you that things that there. So we're hoping we don't have to deal with a licensing fee, but I have to talk to an attorney to know for sure kind of what that's going to look like. The refresher training, we're not sure how frequently we're going to ask people to do that, but that might be the key to getting up our updated library of educational resources that are available.
All right, thanks. All right, so then once people have participated in the facilitator training, we do have some expectations for those individuals. And part of this is just really for us to be able to provide support and to make the training, intentional for you. So for those of you, for anyone who completes the facilitator training, we do ask and kind of have this expectation that you will then facilitate the program in 2027 with at least 10 to 20 participants, and that we can provide the support, as I've already mentioned, to help you facilitate the program throughout the year, to then collect any data that we can use to help us with continuing to improve the program and the facilitation. Let's see.
I think it's worth highlighting with our group that's been offering this virtually, we have 3 facilitators. So you can do larger groups. You just need more facilitators to help accommodate the increased number of office hours and time to prepare your binders.
Mm-hmm. All right, so for resources, I think I've talked a little about a lot of this already, but as like for our program, we did charge $50 for our participants, and that really just covered the printing the binder and then the mailing of the binder. With the cost of postage, we probably should have increased that a little bit, but everybody really appreciates that physical binder with the copies of all the resources. Your participants may be perfectly fine with maybe just links or electronic files, but that's one of the things that we've kind of intentionally, we want to continue with being able to get those resources to people, because depending on the age group that you're working with for your participants, not everybody has access to a printer at home if they want a hard copy, or they have maybe good access to computer to be able to save those individual things. So in terms of staff time, facilitators, throughout the program, facilitators can expect to spend approximately 45 to 60 hours delivering the full 10-month program for a cohort of about 10 to 12 participants. For every additional 10 to 12 participants, facilitators should expect maybe about an additional 20 to 30 hours, primarily due to the increased time spent on office hours, communication, and the peer support group. And so just kind of as a little bit of a breakdown, kind of the pre-programming prep, which we do in October and December, is about 12 to 16 hours. And that's putting together, our registration, getting our registration out, marketing for the program, and then doing the printing and putting together the binders. For session prep and follow-up, about a total of 3 to 4 hours for each session. It's taking us a little less time to prep for each session this year because we've already done it. And so we are, reusing our resources and just updating and, making small tweaks here and there, depending on kind of what we've learned and what we figured out works best. Between that session support, and this is going to be variable, but because we do offer those office hours, what we do is schedule them once a month, and we just schedule a day that we're going to do office hours. And between the three of us that are facilitators, we kind of just, take turns meeting with individuals. If someone has a really specific question that applies to like one content area, then, we make sure that we meet with that individual person. We kind of just, work with our schedule. So sometimes we don't meet with anybody for office hours, and other times maybe we're meeting with 2 or 3 people during that day. And then for post-program wrap-up, it could take about 5 to 8 hours as we are, evaluating and analyzing the data from the post-survey, and just, following up with any loose ends that might have to be done. In terms of graphic design or desktop publishing skills are needed for making those presentations, the handouts, and agenda. We at SDSU Extension have a really great educational technology team that does support us in developing those things. But you want to give yourself some time to be able to get those resources developed as needed. Next slide. Thank you. And so in terms of adapting for your audience or your state, we found that consistent structure is really important. We publish the dates far in advance. Each session that we have, we're consistent on the day of the month that we schedule our office hours. We have our educational sessions with time between the sessions to work on those goals. I think Lacey mentioned this already, but we have during each session, participants complete a SMART goal so that they can identify, something that they want to work on so that they're able to make progress. We give them examples, like during the first session, we say even just simply reading through all of the information can be your goal for the session, or looking at that checklist and just crossing off what you don't have to, what doesn't apply to you. And then during the next session, then we talk about what was your progress on the goals? Were there any barriers? Are there, things that need to be worked on? We encourage individuals to, email us questions between sessions. They don't have to just wait for the office hours to ask us questions. And then, one thing as facilitators, or who are, if you're going to facilitate this program, we want you to be able to adapt the content and examples to be able to fit your location with your audience, and then using those local resources that you might have available. There's great extension resources across the United States, and so we've kind of collected those different types of resources. We've developed some of our own that are specific to our states. So, for example, we have one resource that is about where in your state you can find documents. And so we've, listed those resources specific to South Dakota or North Dakota or Nebraska. And so you would, if you're not in either one of those states, you would need to adapt that a little bit. All right, so, we've talked about this training. We hope that you are intrigued by this program and want to start thinking about maybe your ability to be able to host or facilitate this training within your community. And so the facilitator training that we're going to have in October, registration is going to open in August. The deadline will be October 11th. And we do have a, let's see, we have a form on a web page that we're going to, and I think Lisi's going to put that link. All right,
Yep.
already did it. Okay, she's ahead of me. We have a web page developed where with information about the facilitator training, and if you are interested in the training, you don't have to commit or anything, but just fill out the form on that web page, and then Lisi will send you the registration information. You know, send this information to other organizations that you think might be interested, other people that you might know in terms of that facilitator training. Filling out that form doesn't commit you to the training. It just gives you, we'll send the update when it's ready to go. All right, and so we have, what's most important for us is to be able to share the information that has been developed. So Lisi's putting some links in the chat, but we have a program page, and then we have the page with our resources, and there it is. This just explains the program. So even if you don't want to facilitate the program, but you think these resources are important to share with your clients or the people that you work with, you know, you can always share this page, and individuals can download the information on their own, you know, without attending a program. And so we want to make those resources available to you. Anything specific you want to show?
No, but well, I guess I could walk through real quick. So this is our resource page. I definitely encourage checking out the resources. One thought we had when we made this resources, what about like a self-study option for people who may not need the accountability and support that Organize This program offers? So we have this resource page, and we have the documents independently, and we have a toolkit. You know, so these are the resources that we have that we made specifically. So, and these can be taken and used, you know, by anybody who may not need that support. So we did try to create that like options for those who may not want to sign up for a 10-month class.
Yep. The beauty of the class or the program is that it provides that ongoing support. So here is an evaluation for the North Central Region Aging Network. If you could complete that. And then I want to just jump back to Rebecca. So you had asked the question about how do we get people to kind of stick with it, I guess you could say. And Lisa already mentioned that we had about probably 2/3 of the participants from 2025 kind of stick with it. The other thing that we were able to do last year because of our grant funding is we provided an incentive for participation. And last year's incentive was heftier than this year's is just because of that grant funding. But we offered as an incentive a fireproof, waterproof kind of storage container. If individuals attended, was it all 4 sessions or?
It was like 3 of the 4 sessions, but they did have the option to watch the recording and then email me a paragraph if for some reason they weren't able to come. They had to do 1 session of office hours and complete the post-program interview. This year we're doing more of a raffle, so you know, we can only purchase 5, and you know, if they for every office hour session, or for not every office hour, for every session they come to in office hours, they get a drawing in the raffle. So that's how we're doing it this year. But surprisingly, people are very intrigued by this program. Like our wait list, I mean, it's pretty impressive how this program really seems to resonate with people. I mean, a lot of excitement, a lot of interest has bubbled up around this program. So I really think it's fitting a need.
Yeah.
So hopefully,
so I never asked the question at the end, like, did you stick with it because of the incentive? We didn't ask that question, but you know, there were a couple people that were like, when am I getting my you know, fireproof, waterproof storage container? So I don't know if that was what kept people there, kept people coming back. there was probably 5 people that never attended at all last year, and I haven't necessarily paid attention to our attendance for this year yet. But I don't know. As often as I do online programming, to have 2/3 kind of stick with it, I felt pretty good about that. The rest of you who are in extension are probably like, yeah, that's how I feel too. So I don't know. Rebecca, did we answer your question? Are you still here, Rebecca?
Yeah, hi. Yes, you did. Thank you.
Okay,
Yeah, I appreciate that.
great.
Okay, we should open up for questions because we only got 5 minutes left. So
Yeah.
what questions you can unmute to ask? We don't mind.
Our contact information is in the chat. Most of you probably know Lisi already, but my information's there too. Any questions?
Not a question, but just a comment to say that this is a really excellent presentation, and I look forward to digging into the material better. And I've already signed up for the training, so
I saw that there was notification
Johnny on the spot. Yeah.
So
thank you both.
Yeah.
And if you have somebody else who wants to see this webinar again, email Lorna. We're doing this webinar again on June 12th. So if you want someone else to kind of see us talk about this program, we'll do it again. I'll also be at NEAFCS in November presenting this presentation because we're trying to expand. We think that we kind of hit a need that really can be filled by creating this supportive model.
Mm-hmm. Yeah, and we're here willing to walk anybody through their process to be able to facilitate this program. We're always open for different methods to present. We chose to present virtually because we were working with 2 other states, and Lisi's had the opportunity to work with the senior center in Sturgis, and there's been a good turnout there. We haven't, tried this in a facilitation in person. We tried to do it with the deaf community, and registration just didn't pan out. So lots of different ways to do things. So.
Yeah, and the group in Sturgis. So it's kind of interesting because the group in Sturgis office hours have been packed every time this year, every single time. And so it's been really interesting how much they have wanted it in person, the office hours versus the virtual. But another incentive to draw people is the access to an elder law attorney. I think that is intriguing to people because if you look at our participation numbers, it jumped up again for session 4 when Rebecca, our attorney, came back. So I think having access to an elder law attorney is important. And I guess I'm realizing we should have talked about that. Our guide does have information about how to find an elder law attorney that is qualified because it's kind of hard. Sometimes they want to spend too much time on trust and asset protection. And I want them to focus on the basics. What do most everyday regular people need? So I think having that access to an elder law attorney is another incentive that helps keep people coming back because they like having that access. And people like talking to me, Laura, having that 101 access to a professional that knows something about this stuff that they don't have to, that's not trying to sell. That's what they say in Sturgis quite a bit. This is the best program I've been in. It doesn't feel like you're trying to sell me something.
Yeah. And just as a note, when Lisi facilitates in Sturgis, what she has done is just use the recording of our presentation from our virtual session, and then shows that for the content. And that's just how we've chosen to do that in order to manage the 2 different locations. And then just stressing that with your elder law attorney, like ours is doing it at no cost, which is wonderful. I don't know if that's the case for all. And then we also want to make sure that they're not trying to sell their business. sell it. So like sign up with me, I'm the only one. We have had participants who actually have then contacted that individual, but she does not sell herself, I guess you
No.
could say.
Yeah. Because that's a very important thing that you have to manage with these elder law attorneys and estate law. I mean,
Yeah.
yeah.
Yeah. Oh.
We appreciate your time. We're at the end of our hour. This was recorded. It will be posted on the NCRAN YouTube channel. I hope you completed our evaluation. Thank you. Reach out if you have questions.
Thanks, everybody. Have a great day.
I don't know how to stop the recording.